Hello, everyone. You're watching the Fun Sparkle Drama Show. I am your host, Nico Cervantes. We have a very informative show for you today. We have Jessica Barker from Pacific Plastic Surgery. She's a physician's assistant there, and we're going to be talking about injections, botox, Juvederm, and Voluma. But before that happens, I want to introduce a very special person in my life, Miss Nina Lafuente, my co-host. How are you?
That was all like rap.
It was like co-host. Totally like, yeah, co-host.
I like it.
How are you?
Good. I've been listening to a lot of rap this week. So
oh, really?
That was good. Yeah. Like old, like I'm like surprised how much rap music I know.
Like Puff Daddy or like
the whole gamut. Yeah.
Like what is
Too short. That's kind of intense.
Okay.
T.I. Love T.I. Like, I don't know, just kind of listening to it all.
Yeah,
So when
I
you're
love
all
it.
my co-host, I was like,
I know. Well, you know, we've got a little ghetto in us.
We do.
It's
we
like
have a
fading
lot.
as I'm getting older. I want to keep it real.
Well, I'm a little older than you, so it's still there. It'll come back around. Don't worry.
I did grow up on the east side. Anyway, I am really excited about our show today.
I know, me too. I love me some Jessica.
Yeah, so definitely. Well, like I'm going to talk about how I think injections are kind of maybe like some people are kind of maybe against them or scared of them or
I have lots of questions for her, like, you know, like people are like, oh, is it poisonous or you're putting this in your body or so I want to find out because I'm like, yeah, okay, maybe like people have their opinions, but people are looking fierce right now.
Yeah.
I think it's
amazing.
Yeah.
I love everything that like expands our knowledge in our world. Like, you know, we're moving forward. This is stuff that we have access to that we didn't before.
Yeah.
Like, why wouldn't we use it?
Yeah.
You know
like
what I mean?
The polio vaccine.
Yeah, right? Well, also, we're going to be doing a little demo later.
Oh, we are?
Me.
Oh my God, I can't wait to see this. What is she going to do?
I'm not sure. She's going to assess my face and let me know what I need.
Oh my God, I'm totally going to be right next to her.
Yeah.
So with that said, what did you do over the weekend?
Over the weekend, I was in a drag show. But the weekend before, I was at DragCon.
Oh, right.
Which was like super awesome. I've been like very much into drag lately. I've always been into drag. Like the moment I saw Divine in Hairspray, when I was like 8 years old, was like I was obsessed with drag queens. Like literally, and then I watched Priscilla, Queen of the Desert. Like I was that kid. I was a weirdo.
Those are all campy ones too.
Yes, I love campy drag.
Yeah.
Like I appreciate all drag actually, but I love like the campy, like over the top drag. So DragCon was the very first convention ever in history that was focused around drag and drag queens.
This was the first one?
First one ever. Ever. And RuPaul hosted it, and it was his idea, and there was over 13,000 people there.
Oh my God.
It was crazy. And it's weird, you know how attached I am to my phone?
Yeah.
I didn't hardly take any photos.
I didn't hear from you all weekend. And that's rare for us to like not talk for a few days.
It was like Disneyland.
Yeah.
I literally walked in to the DragCon, and I was like so on sparkle overload, and drag queens were walking around, all the famous ones from RuPaul's Drag Race, and there was people selling eyelashes and makeup and costumes and jewelry and everything over the top. It was just overwhelming. I didn't look at my phone at all, and I forgot I even had one. It was just like, and then I went with some really great my gay gaggle, my boys, and we had an amazing time, and it was so awesome because I actually used the hashtag. I got on social media after on my way home to Santa Barbara, and I used the hashtag DragCon, and I got to see all the photos. And what was amazing were there was all these families there with kids, little babies.
Oh, I love it.
And there was like probably over 50 pictures of drag queens holding babies. And the look on the babies' faces were like, oh my God. It was like they were like Mickey Mouse was holding them. They were like so enthralled. It was crazy.
Yeah.
Like it's going to be the new.
And they had performances and.
They didn't have any performances. They had classes. Like I took a wig class.
Oh, okay.
Like
That's
I had
what
to
I was
style a
gonna ask.
wig.
They had like tips and stuff.
Yeah.
Like I remember when Deja was on, she was talking about like getting dressed.
Yeah.
And like how it's all drawn.
Padding.
Like the padding and all that.
The 5 pairs of pantyhose, the tucking.
So I hope they had a class on that.
Yeah, they had a class on that. They had a class on everything you could imagine. I took the wig class, and I took, what other class did I take? Oh, I took a makeup class about
Do
makeup.
they have like a fish class? Like I want to go and teach a class.
Yeah, I mean, yeah, totally, you should. Like all
a real
confidence
woman's
class.
class,
Yeah,
yeah.
how to have a women's confidence class. It was amazing. It was awesome and such a great experience. And then we're gonna do it again next year. So
I love
go to
it.
DragCon, support it. It's awesome.
Where were you over the weekend? You said you had a fun weekend.
I performed in drag for the first time in 9 years. So I've been I've been getting more into drag, and because I stopped doing it. I did it a few times in my early 20s, and people's reactions to it were really harsh. Like clients, friends, family were like, oh, like, do you want to transition? They were very weird about it.
Right.
When I thought about it, and it's like I've always loved performing. I went to clown school when I was a kid. I interned at the circus. Like, it's basically the same thing. You put on a lot of makeup, and it's as much as I love to put all the makeup on,
right.
I love to take it off. Like, I love my man body. I love my penis. I love everything about being a man. So it's like it's fun. It's like a show for me. And so I got to perform for the first time, and that was incredible.
Yeah.
But I was around a lot of young kids.
Yeah.
And
well, I think too, like when you last performed, you were in your early 20s, and it's one of those things where you've grown and matured so much that it you can kind of do that now, like without questioning it. Because when we're in our early 20s, we're very like we're forming who we are as adults, and we're trying so many different things. And for people to have any sort of criticism towards that makes it feel like, oh, God, maybe I shouldn't. But now you kind of own it more, is what I'm seeing.
I mean, I was very Uncle Nico to them, and I kind of and I enjoyed that part of it. I didn't it wasn't negative for me.
Yeah.
And speaking of Uncle Nico, we've got an Uncle Nico question. It's our second week of doing Ask Uncle Nico.
Yeah.
If you want me to answer your questions, hashtag Ask Uncle Nico on Twitter, or send them to our Facebook page. Anyway, our first question, actually our only question today, is I wish I had more. Please email them is from Erin from Oregon. And she says, Dear Uncle Nico, I really enjoyed your last episode with Michael Stern, especially the section where he talks about the celebrity interactions, his celebrity interactions and the good and the bad. Who was your favorite celebrity to meet, and have you had any bad experiences? Yeah, I love it. Michael Stern was great.
Yeah, that was fun.
I think my best celebrity interaction was probably Angela Bassett.
Oh my God.
Like
I can't, I'm like, when you met her, it was like too much.
I mean, we've always loved the movie Waiting to Exhale.
Yeah, we make many references to it in our everyday life.
She's so strong. I loved her in American Horror Story. And so when I saw her, I actually was at a benefit. And you know me, like, there's something that comes over me. Sometimes I have so much confidence, I don't think about anything around me. In the ghetto, it's like, they call it like, you can't look beyond your own weave.
Yeah.
And it's like, that's very me. And she was sitting down at a table, and I feel bad about it, actually, now that I think about it. But I went up to her table and she was sitting with like a bunch of other celebrities. And I was like, hi, I love you. Can I please whatever. And she was so nice. She got up, she gave me a hug, and I was wearing a brooch, of course. And so we went to go pose for a camera. She goes, oh my God, you have to switch sides. Your brooch has to be in the picture. And she was like, where'd you get that? And we chatted and she hugged me. And it was just like, made me feel so good.
Yeah, well, I mean, she's great.
Yeah.
And she probably saw your energy, but then also you have to realize, like, people way crazier than coming up to her at a dinner have come up to her and asked for her attention. You know what I mean?
I know.
So,
I was like...
But it sounds like, and that was a safe setting. It was like some event and there were other celebrities. I think like Oprah was at her table. You didn't even go up to Oprah.
I didn't know Oprah was there, actually, because until later, and then I was mortified. But there was a lot of other celebrities there, and there was one that actually was like kind of mad dogging me a little bit on the other side, and I won't say who it is.
Why not?
Because they're friends, and I don't want to disrespect Angela. Okay. She really supports his career. It was a man, and he was totally giving me dirty looks.
Straight man.
Mm-hmm. And they were in a movie together. Anyway, so the point is that it made me feel so great about her, and every time I see her on camera, every time I see, a movie of hers or whatever, I hear her name, I just get the warm fuzzies. Yeah. Anyway, that was my positive interaction.
Yeah. Negative
was Jennifer Aniston. But a lot of people say she's got anxiety issues, but she was very off-putting to me. And it made me very much change my perspective of her.
But you also I remember when you met her, you had also said, she's kind of like Beyonce or Britney Spears because she's so famous. It's like, I don't know how you can be normal in a setting where you're not outside of your nucleus, your home or whatever, and not feel
Well, you've been famous for so long.
Yeah.
You know what I mean?
She's so big.
Yeah.
Yeah.
So anyway, Erin, thank you for your question. We have to move along with the show. We're going to take a little break, and when we get back, we're going to have Miss Jessica Barker. So stay tuned. Don't leave. Bella Vista Designs is Southern California's premier audio and visual company, specializing in decorative lighting, draping, and sound for your upcoming wedding or event. Welcome back, everyone. I'm your host, Nico Cervantes, and you are tuning into Fun Sparkle Drama. Today we have Ms. Jessica Barker from Pacific Plastic Surgery. Thank you, Jessica, for being here.
Thank you for having me. I'm so
You're awesome.
excited to
We're
join
like
you.
so excited to get pumped.
Yes,
Is
that's
that
what I'm
called?
here for.
Is that pumped and plumped? Tell me
It's a
about
little both.
Pacific Plastic Surgery and all the services you offer.
So I've worked with Dr. McKenzie at Pacific Plastic Surgery for 10 years now.
Wow.
And he does pretty much everything. He does breast augmentation, reduction, liposuction, tummy tucks, faces, and then myself and our nurse Cassie, we do the procedures in the office, which are mostly injectables, like botox, Juvederm, Voluma, and then we have a couple different lasers that we use too. An
Awesome.
IPL for sunspots.
Yay.
And we have a new, really cool Smart Skin fractional CO2 laser.
And what does that do?
It's a collagen stimulator. So it's like laser
mama like.
resurfacing.
Yes.
Fine lines, pore size, wrinkles, acne scars.
Yes.
Yeah.
Awesome.
Oh my God.
Anything.
God, this
That's
is like right up my
amazing, all
alley.
of this stuff.
I love it.
It's pretty fun.
So tell me a little bit about, because we're going to focus on injections, and later in the show you're going to do a little demo on me.
Yes.
Tell me a little bit about injections, and we'll start with Botox. Tell
Okay.
me a little bit about Botox and what it's for. And
So Botox has been used for over 20 years, and it was first used for medical indications like lazy eye or twitching of the eyelid. And when they were using it for medical procedures, just serendipitously, they realized that it actually affected wrinkles. And so then it was studied and used cosmetically.
Can you imagine being the person to like discover that? They were like,
Yes.
it stops wrinkles.
Yes.
Yeah.
It was
That's
a
crazy.
husband and wife doctors, the Carruthers from Canada, that put it together. And so then they started studying it cosmetically. And basically it's used for frown lines, crow's feet, horizontal forehead lines. We can use it in the lower face as well. So that's its cosmetic indication. And now it has, I don't know, at least 10 other medical indications since
Wow.
then. Yeah. So
Like-
headaches
Yeah.
and
Sweating, I heard that.
yes,
Yeah.
hyperhidrosis.
Really
the
sweating, like,
technical
in
Like
the-
people can
term.
get it in their armpits.
You can have it in your underarms. You can have it in the palms of your hands.
I need to do it there.
Yeah, and actually lasts a good 6 months
sweater.
for sweating. So yeah,
That's crazy.
It is. It's pretty cool. There's
What
all
ab-
kinds of things.
What about Juvederm?
So Juvederm is totally different than Botox. Botox is a muscle that, it's a medicine that relaxes the muscles so they can't contract, and when they can't contract, they can't pull the skin and make a line.
Okay.
So it's good for dynamic lines, like the smile, lines around the eyes. But fillers are more for volume loss. So fillers can be used in your nasolabial folds, in your cheeks, your oral commissures, and your lips, pretty much anywhere in your face that you have volume loss.
Over age.
Over
right? That
age.
happens.
Yeah.
Or if you want more volume, like I was talking earlier about
Right.
Kylie Jenner. Like,
right.
Yeah.
Yeah,
That's
we
when
do
people-
get a lot of younger patients who are just looking for more volume in their lips, whereas older patients that are coming in for their lips are more focusing on the lines around their lips.
Yeah, absolutely.
So you treat those differently, kind of depending on what they're looking for.
Yes. And then what about Voluma? I love that name, Voluma.
Yeah, it's
It's like a drag queen
Yeah,
name.
exactly.
That's why you
I was
love
like,
it.
why can't I?
maybe that could be your name.
That's all
Yeah.
Voluma.
Voluma Cervantes.
Totally, right?
It's got a ring to it. So Voluma is the newest hyaluronic acid that's been approved, and it's specific for cheeks.
Is it an acid?
Hyaluronic acid.
Okay. So wait, what is hyaluronic
Hyaluronic
acid?
acid is a sugar that's found naturally in the skin that pulls and binds with water. So when you place it under the skin, it brings water into the tissues and plumps it up and gives you kind of more volume in that area. And so Voluma is indicated for the cheeks, and it gives a lift to the kind of mid-face.
Wow.
I have
Yeah.
a question.
Yes.
So everybody says, okay, so what I've heard is, Botox is a toxin. And so all of the naysayers are like, I'm not putting that in my body. But then the Voluma and the fillers, I've heard, our body makes
natural.
that. Like the hyaluronic acid, we make that too. So
Right.
what is...
Yeah, that's true. I mean, hyaluronic acid is found naturally in our skin, and it does deteriorate over time with age. Whereas botulism toxin, so Botox is a purified protein of botulism toxin. It's a very, very, very microscopic amount of the Botox. So say, we use maybe 20 to 40 units when we when we place it in the face for wrinkles, whereas to have any systemic effects, you'd have to use thousands and thousands.
So it's
of
kind of like
units.
saffron. You use it for cooking, but that can be
exactly like saffron.
No, but isn't saffron can be toxic?
Maybe we should start injecting that instead.
I know, right?
No,
And
someone
we'd all
told
be
me
orange.
saffron is toxic in high levels.
In high doses, right?
Oh.
Yeah. No, I
Right?
think
So it's
you're
like
right.
putting saffron in your face, basically.
I
Or
love
paella.
it. I love it.
And putting Botox in your paella.
Yeah, so that's the argument that I hear from my clients or friends who don't want to try Botox. They're like, oh, it's a toxin.
Yeah.
But I mean,
Yeah.
it would really have to be a lot.
Yeah.
Right.
Okay.
And two, I want to talk a little bit about prevention. You know, when a lot of my friends around my age or younger
Yeah.
are like, oh, I'm too young to get Botox or I don't need it. But really, it's talk about the prevention benefits.
Yeah, well, the idea is if that you're not contracting that muscle and making that wrinkle in your skin repetitively day after day, that you're not going to make that line so deep over time. So there is definitely some proof there that it can be a preventative effect. And I did hear recently at a conference that the average age for getting your first Botox is now 31 years of
Wow.
age, where it had been 41 in years
yeah.
past. So definitely younger and younger patients are getting it done for preventative effect.
I love it.
Yeah.
So I'm sure you get patients of yours that come in that have kind of a warped sense of reality when it comes to their face or their body or whatever, especially your face. How do you deal with that, with saying, because I think you have a very good reputation in town for
Thank you.
being very conservative and meaningful with your injections. I don't know if you know that, but
Thank you.
it's known amongst the community and
Yeah, like a natural, like people
Yeah.
don't leave your office and be like, oh.
yeah. So, but that's what you're known for, and that's really great. It's like this is where just what you need. I'm not going to go overboard on you.
Yeah.
So how do you have that conversation with clients?
Well, it's tricky. I mean, I'll ask the patient first, what's bothering them, what they want to look to improve, and then I have to match with what they want to do is with what I think they need. And sometimes those match up fine and sometimes they don't. And oftentimes people are focused on one specific thing, but you really want to look at the face three-dimensionally and kind of make it all match and not just focus on one area. Like a lot of times people will come in and they're just thinking about their lips, but if I just give them big lips and the rest of their face is sunken and wrinkly and sallow, it's not going to turn out so well.
Yeah, absolutely.
So, yeah. So it's
and we've
just,
all seen those people.
yeah. It's just a matter of, just kind of educating them and kind of having them look at themselves three-dimensionally. And
it's not forever. So if you maybe
Right,
do
right.
something, do maybe a little too much, then it's going to wear off. Then
Yeah.
you know next time.
Yeah, so Botox is 3 to 4 months. Most of the fillers are around a year. And a lot of the fillers are reversible. People don't know that. There's
Wow.
an enzyme you can inject and you can dissolve the filler if you absolutely hated it.
Yeah.
But that rarely happens.
So I know of somebody that recently that has gotten Botox in their neck.
Uh-huh.
Tell me about that whole situation. It really, I've always had this gobble, Jessica, and it just like always, even when I was young. Well, it was in my 20s, but it really bothers me. What is this whole neck situation? Does it help the gobble or no?
Well, there is a new drug that just got FDA approved called Kybella, and that
Ooh.
is injections specifically for the gobble. It's a series of 4 injections once a month. We're going to be getting it at our office soon.
Kybella,
Kybella, yeah.
drag name.
I love
Another
right?
one, Kybella Cervantes.
These are
Yeah.
all drag names.
And you know what? The Graphlings love their injections. I'll tell you that much.
Yeah, but as far as Botox goes, you can use it in the neck to treat the platysmal bands, which are kind of the tight muscles in the neck that
Yeah.
project. And you can also use it to treat what we call the necklace lines. But as far as the gobble, Botox isn't super effective for that. It's either now the Kybella or something like liposuction, or
Yeah.
we have some lasers or surgical.
Awesome.
Yeah.
Yes, and you do that too. It's important,
Yeah, yeah.
I was telling Nina, honestly, like we're progressing in life. It's like, and this is really what my show's about, is embracing that, like, our evolution. So
Right.
it is awesome. This was so informative, but we
Yeah.
need to take a break. And when we
Okay.
get back, Jessica's going to do a demonstration on my face
Oh my God.
Excited.
without makeup. Don't judge me. Anyway, I will see you when you get back. Don't go anywhere.
Welcome back, everyone. Thanks for joining us. Jessica Barker right now is going to do a demonstration of a Botox injection on our little Nico. So if you have an aversion to seeing needles or there might be a little blood, you might want to tune out right now. And if you don't, then stay tuned and we're going to do it.
So anyway, if you want to assess my face, let me take my glasses off.
Well, usually I ask the patient first if there's anything that's bothering them or anything that stands out to them that they would maybe like to correct or treat. So
I've got really small eyes, Jessica, and I have a problem with squinting. And really it's because I've got heavy lids, and I've been told by my eye doctor that I should go get lid surgery because as you get older, the lids start to drop. And so I'm avoiding that. So I think that's someplace that's always really bothered me. And then these lines on my forehead I've had since high school.
Okay.
And they've all bothered me as well.
bothered you, okay.
So what do you think?
So then usually I'll ask the patient to frown for me like they're mad, like scowl between the brows, and then raise up like you're surprised, and then smile for me. Okay, so with the Botox, there's 3 common areas that we usually treat. So the first area right here is called the glabellar area, and that area, basically when it contracts, it makes what we call the 11s or the scowl lines. It also pulls your brow downward. So if you really want to opening up your eye, make yourself look relaxed,
Not
refreshed.
look so bitchy.
Or that.
Resting bitch face.
If you don't want a resting bitch face, then
God, it gets
we
worse.
put the Botox right in there, and that kind of softens that area.
Awesome.
Give
We
him that one.
also put a little bit of Botox at the lateral or the tail end of your brow, and what that does is that lifts up the the outer aspect of your brow, which is really helpful.
Yes.
And then you can also carry the Botox all the way down and around to tackle the crow's feet or the little lines that come out from the sides of the eye.
I think you need
Or
this.
you could just walk around with Nina like
Yeah,
that.
I want
him to do
Don't use
this.
Botox. Now, the only thing is, if we do treat these horizontal forehead lines, we can soften those lines with the Botox, but that muscle is elevating your brow. So
Oh,
you may
yay.
compromise a little bit of the lift, actually, if you weaken that muscle. So there's a little bit of a trade-off between getting rid of those horizontal forehead lines and lifting your brow. It's counterintuitive. I can't tell you how many times a day people come in and they say, just give me a little lift with Botox. But if I put the
Right.
Botox where they're pointing, I'd actually bring their brow down.
Can you see my nose hairs from this angle? Sorry, everyone.
All right. Are you
Anyway,
ready,
let's go. We're
Nico?
ready to go.
Okay, let's do it.
Do you want to hold my hand?
No, I'm fine.
He's totally holding my hand.
Oh,
So Jessica, I think I might want to try the Botox. Kidding. No, I've been doing it, as we all know. I'm 40,
Blah, blah, blah.
blah,
blah, blah, blah.
and I've been doing it. I started, I think you and I have been friends for a long time, but I think I started when I was done having
Yeah.
kids and nursing and all of that.
Right.
Because you
So
can't
maybe
do it when
like-
you're nursing.
No, you can't do it. Oh, you're not nursing.
Yeah, what are
Nico.
who are
Yeah.
people
Well,
who can't do
even though
Botox?
sometimes,
So not while you're pregnant, not while you're breastfeeding.
Oh, damn it.
There's a few very rare neurological diseases that can't be treated with Botox, but I've actually never met anyone with those. So
Okay.
it's
Yay.
pretty much most anyone.
It's like
that wants it
aspirin.
Taking
can
out the rest of my bone.
yeah, can do it.
And no, but what I love about Botox is it's the preventative factor.
Right.
So, and what I love about you doing it is that no one thinks I do it. Well, maybe.
Maybe. All right, Nico, are you
All right,
ready?
yes.
Good.
Okay. Okay, and relax.
We
And
can't
frown
talk during
again.
this.
Let your mind. Okay, and relax.
Can I talk?
No.
And frown. Sorry, we skipped the ice and the numbing. Relax. Frown. smile. Okay, and relax. Sorry, honey. And then turn all the way towards me. And then smile. Okay, and relax. Last one. That's it.
It's free. Be a drag queen.
Okay, Bella.
Jessica, I feel
How was
younger
it?
already. Is it like Death Becomes Her when you get like young instantly?
Well, it actually takes about 3 days to start to kick in, and then its full effect is at about 2 weeks.
Okay.
So by our next show, you're going to be all
Fierce. Yeah.
Will be.
Yeah.
So what's going to like? What are going to be the effects? Like, what do you think we will all see like by the next show?
So he won't really be able to scowl or frown. These little lines in here will be softened. His brow will be slightly elevated, and then the kind of the tail end will be lifted up a little bit here, but really subtly and naturally, not won't look fake or strange.
Yeah.
So what does Botox cost?
So we price it per unit. For me, it's $13 per unit. Today we used about 24 units. So 24
For you
times.
to inject it, it's 13.
Yes.
So someone not as good as you, it could be like 12 or 10 or.
Yeah,
okay.
yeah.
Okay.
Something like that.
Yay. Oh my, Jessica, thank you so much.
My
for,
pleasure.
You're amazing.
It was
I
super
love
fun
you.
to come and hang out with
Thank
you guys.
Thank you so much. And tune in to the next show.
You can sit up. You don't have to be all drunk.
Oh, God.
Yeah.
No, I feel amazing, actually. And so will you after you get your Botox.
Thank you so much for joining us tonight, and a special thanks to Jessica Barker for stopping by and sharing with us all the information that she does at Pacific Plastic Surgery. You can check out their website, pacificplasticsurgery.com. Be sure to look up Dr. Mackenzie. And if you'd like to donate to our website, Fun Sparkle Drama, it's patreon.com/funsparkledrama. And any sort of amount would be amazing. So thank you so much, and we'll see you next week.
Yes, and please follow us on Instagram and Twitter, and like our Facebook page, all Fun Sparkle Drama. Thank you, everyone. I will see you next time when I'm going to be lifted and fierce and plumped. Thank you again for watching. I'm Nico Cervantes. This is Nina LaFuente. Thanks to Jessica, and I will see you next time. Bye.